There are one or two other things I want to talk just very briefly about. One of them is cataract. What can you do for cataract? Well, once cataracts have reached a certain stage, then orthodox treatment is the best treatment. Once they've progressed so far that a large part of the eye a large part of the lens is opaque, then surgery is the best option. And so our role there is like to support the surgery, to bring qi to the eyes, so that the healing takes place more quickly than otherwise would. But if the cataract is in its very early stages, and particularly when the cataract is off the visual axis, so is not causing major problems, at that time you can be of great help. And the help you can provide is based on understanding why the cataract occurs in the first place. As I mentioned earlier, that the cataracts happen when there's heat in the system, when there's heat which is consuming the yin. And typically you see liver and kidney, well, they call it weak heat, but actually is it weak heat or is it yin deficiency? It's heat, but it's like there's a weakness behind it. And the other pattern is lung dry or lung yin deficiency. So there's a lung pattern as well, because the lungs are to do with the fluids as well. So once you know this, then you can take the necessary steps to clear the heat. Just as in diabetic retinopathy, the key is to clear the heat, which is destroying the yin. So in the case of cataract, you need to clear the heat, which is destroying the yin. Usually, it means tackling it on a number of different fronts. It means treating with acupuncture to clear the heat, because I personally think acupuncture is very good at clearing heat. It's good at clearing liver heats. It's good actually at tonifying the kidney yin. It's good at clearing the lung heat as well. But you will also need to look at the factors which are causing the heat or sustaining the heat at the same time. For example, my uncle had cataracts which had progressed quite quickly, but then he was a great whiskey drinker. I strongly advised him to stop drinking whiskey, but he looked at me with the sort of sympathetic look which an older person regards a younger person. No, my boy, I'm not giving up whiskey. I'll have the operation. He had the operation and that was it. So in his case, it was the whiskey which is causing the heat. You must look and see what it is that is causing the heat of the cataract. So once you know what it is, it's easy to take the steps. Well, relatively easy to take the steps, or to know what steps need to be taken, even if the patient doesn't want to take those steps. And so if you've managed to clear the heat and to bring the qi to the eyes, then the factors which were causing the cataract have gone, and there's the opportunity for it to heal somewhat. And if there's only a relatively small cataract, there's a good chance that that can disappear altogether. If it's a very large cataract, well, it might improve slightly, and the best in that case that one can hope for is that it won't progress. If it's a very large cataract, it may, and it's actually obscuring the vision, then at that stage it might be better to go for the operation. There is an alternative treatment to acupuncture, and this is very useful for those patients where you've more or less cleared the heat, but not sufficiently perhaps for it to for the healing to take place completely. And in this case, you can supplement the acupuncture treatment with some eye drops. There's a long history of use of the herb Cineraria maritima, which is a herb, a plant from the ragwort family, and these are available in eye drop forms. In particular, these eye drops are made by a firm called Dr. Reykjavik, and they are available through homeopathic pharmacies.